And welcome to this session. We have with us Professor Sujata Sriram. She's from the Human Ecology School at Tata Institute of Social Sciences. Welcome to the summit, Sujata.
Thank you so much. Thank you for asking me over.
Sujata, you've been spending years and years in teaching and in research, and one of the areas you work on is mental health. Clearly, this has been a very trying time, the last 8-9 months for millions of people the world over, but especially in India. And what is the sort of key things that you see springing up because of the experience of the pandemic in the last 8-9 months?
So, the pandemic itself has been extremely trying for everybody and also for mental health professionals, because one of the things that's come to the forefront is the crisis that is there in terms of the disintegration of all systems that we used to take for granted earlier. Working women used to meet with their friends over lunch. The shared dabba over lunch was great pastime. It is actually the time when you could share the things that, with colleagues, laugh about things, share fairly, moments that you probably wouldn't have shared with family. And suddenly that's all taken away from you. I'll give you another example. People used to go out for a walk evenings. Suddenly lockdown happened. You can't leave home.
Sure.
So those of us who've been lucky enough to I have a nice big balcony to walk on. Okay, so I've been walking up and down on the balcony. I've been trying to get my 10,000 steps, but what happens to people who don't have that kind of space? People who used to take going to the gym for granted. Sure. Suddenly that gym is not there for you anymore. You used to swim every day. Now the swimming pool is out of bounds for you. Let's also look at another situation. You have people who used to, and most Indian middle class homes, we have, the people who we refer to as servants, house help. A lot of, for working women, a lot of our burden in terms of doing household chores and things like that is taken care of by these very often other women. And it makes a lot of difference in terms of, the time that you would get to do other things, intellectual things, suddenly now gets taken up by doing jhadu, pocha, kapda, bartan, and childcare, adult care, house care, self-care, of course, gets left behind. Yeah. So what happens as a result of all of that is an escalation of mental health issues. And so one of the positive things that's emerged out of this is that, this entire tele-counseling, telemedicine, that's come up in a big way. A lot of people who otherwise may not have been able to access mental health have now begun to access mental health services over the telephone, over Skype, over Zoom, multiple methods which otherwise weren't really available. So I think that's one of the, I'd say a positive that's come out of it is the fact that, we've had to innovate, think out of the box in terms of how to make these kinds of services available. But on the flip side, if you look at the kind of stress that has actually increased, we talk about work from home and how work from home is a panacea for all ills. No way. I think work from home is actually increasing the amount of mental health stress that people are going through. I'd say the kind of, and again, let's also not forget that, right now jobs are also under threat. We don't know whether, our jobs are safe. There are corporates which have fired people, usually because of the fact that they can't maintain that kind of a staff strength. There are many people who've had to work on, same kind of a job maybe, but on a more limited salary. Salaries have been cut. And, you get to know about the cut in salary end of the month. Okay, you've already put in that amount of work, and when you look at your pay slip, it's that much less. And again, you also think that, look, it's better to have a job and get some money rather than not have any money at all. Yeah. And that's leading to a hell of a lot of stress because you don't know how to regulate work and home together. I'd say, the boundaries, the separateness that used to be there between home and work is now suddenly taken away.
True.
And again, how many of us have that luxury of converting home into office space?
Right. Very true.
Most of us don't. I mean, I'd say the average Indian doesn't really have a home where you can have the luxury of having a separate space all to yourself. And again, if you do, I'm sorry to say that most women don't have access to that space first. I mean, we take the internet so much for granted. But how many of us actually have that facility of broadband availability in our homes? I know stories of people working, who, struggle to find a space where, they're getting connectivity. And if one person gets connectivity, the other person gets locked out. Right. So in terms of, which space is the place where, you get the best connectivity, who uses the dining room, who uses the study table, who doesn't use anything, who gets the bed to work on. And the irony is that, we have suicides. We take them for granted, okay? Incidentally, India is the suicide capital of the world. We have a higher rate of suicide, not just all suicides, again, people below the age of 45, but female suicide, if you look at it, I think we have the third highest rates of female suicide in the world. And this pandemic is actually increasing the kind of stress that women are under.
Absolutely. And, you hit upon something very important in terms of work from home and the stress that's placing on both the person working as well as the support system, the family. And, where do you see the role of the employer, large corporate, let's say, which has 20,000 employees, 50,000 or 200,000 employees. And we've all seen the statistics coming out from either Government of India funded studies or the WHO, which is talking about almost 1 in 5 people in India requiring mental health interventions. And this was pre-pandemic. It's anybody's guess what that ratio is right now. It's probably like 1 in 4, right? And if that was the statistical number bandied around, and if you've got, let's say, 10,000 employees, which means you've got a few thousand people who need help at some point in time. Maybe not serious help in terms of medication, but certainly help nevertheless. And even if we were to say that, let's not do it for the altruistic reason that we need to take care of the employees, there is a business imperative, right? These are people who are, maybe talking to your customers or investors, shareholders, suppliers, making financial decisions, buying, selling decisions, etc. And you have a fiduciary responsibility over and above the altruistic responsibility, right? So where do you see the role of large organizations coming there? And the follow-on question would be, what do you think the chief learning officer can do in this?
So first off, I'll say that you can't separate out the altruistic and the business motives. Okay. The altruistic motive and the business motive need to come together. Otherwise, you're not really going to have anything in terms of being able to address mental health needs of people. And at the end of the day, if you want to look at mental health, and the need to address mental health issues, I feel that corporates need to, start talking the mental health language, which then means that, they need to look within and see what are the kinds of policies that we have. Do we have a mental health policy? And we do have a mental health policy. What are we doing in terms of implementing that mental health policy? If it's going to be HR that's going to be responsible for it, how does HR do it? We're talking about, the learning and developments, part of the organization doing this kind of work. How are they doing it? What are the messages that we are sending out about mental health? Is it okay for somebody to say that, look, I'm not feeling okay. I'm not feeling too good today. And then can I work from home? Yeah, sorry, I'm saying, can I work from home? Because I feel that, when we started looking at work from home as an alternative, which actually came in from the IT companies, it was actually meant for mental health of women. in the sense that, look, if you wanted to balance work and home,
Sure.
one of the ways of doing it was this, giving you this option that, look, you don't have to come in all 5 days of the week. You
True.
choose which days of the week you can work from home. Unfortunately, the crisis that we are in right now, the pandemic, has taken that choice away from us, and it's pushed all of us to do work from home, whether we want to or not.
True.
And organizations haven't really woken up about how to support people when they're trying to work from home. Questions that you need to ask, can you really start work, whether man or woman, can you start work at the same hours that you used to if you were coming, to in-person office? Do you need to? I mean, I personally have found that, this online work, you can actually cram in much more in a day than you would if you were actually talking about coming into office in the face-to-face, in the offline mode. Okay, and that's primarily one of the reasons why it's being touted as a good business alternative, because of the advantages that you would be having. But at the end of the day, are companies looking at doing enough for their people? Especially, I'll come back to talking about the problems that women face. Because I feel that, women are the ones who are actually, caught in this cleft stick, okay, in this. They're actually the ones who are, get the worst end of the bargain.
Right.
Because, when you're saying, all the support services that I mentioned earlier that we take for granted, school, you could send your kids off to school and that they're not going to be on your head, so that, and you could work in peace when you're working from home, out of choice. That's not there anymore. Where are the, your grandmoms who used to look after your kids, and that, auntie, neighborhood auntie who used to look after kids? It's not there anymore. So corporates essentially needs to start talking about mental health. They need to start being more aware of the fact that employees need support.
Right.
And they need to be able to extend out to ask, look, how are you? Is everything okay? I don't think any organizations are really doing that on a sustained basis in terms of reaching out to employees and asking, look, how are you feeling today? When you're starting a meeting, do you ask about, look, how is everybody? And how's everybody staying safe? What are the things that you're doing? What are the kinds of pressures that you're facing? What is it that you as a family are going through? How are you managing? And again, all the shared stories that come out, I feel that those are very important to try and capture, because that's where the narrative comes in of being a caring organization. It's not enough to pay money. The salary is not the only thing at the end of the day. There's a lot more that makes organizations caring organizations.
And
whether it's leave policy, all of those things need to be looked at.
True. And you're so right. One is about, saying, how are you feeling? Just being there, being there, give a empathetic ear to listen to what's going on. And I would even stretch it further to say that it's not just about mental health when something's wrong, but as you would know, in mental health, it's about preventive health.
Absolutely.
We should be able to do things so that, again, from a performance perspective, we all know that, let's say, anxiety will hamper your performance. Anxiety will hamper the kind of decisions you will make, right? Or, eating disorders, or, sleep, right? It's in the organization's interest to take care of, people's overall health and well-being. A happier employee.
I'll bring in another thing. Okay, I'll bring in the issue of gender and sexuality.
Sure.
Because I think, we don't necessarily walk the talk. On the one hand, we have laws that talk about equality between the genders, the multiple genders. But what are organizations doing? Because frankly, a corporate can be the worst place for a person to come out. Organizations can be a terrific and a terrible place for sexual bullying, especially if you're seen as being different. I think there's a lot that comes up, when you're seen as being different in terms of the way you behave. And companies can be terrible the way they pick on people, and you can be harmed.
So there is
how many companies want to address that kind of an issue at all? How many people want to talk about a posh, we all talk about how, there is a posh committee. But who's serving on the posh committee? What are the kinds of issues that your posh committee is dealing with?
Right.
Do you talk about gender awareness? Do you talk about awareness about sexuality? Or do you only talk about the binary?
No, clearly there is so much to be done, Sujata, and thank you so much for even bringing up the nuances of several of these issues. I'm sure we could go on, and there's so much that organizations and individuals need to do for overall mental health, mental well-being, and if I can say mental fitness of their employees. And perhaps in our, we do a series on mental health, especially with you, to go into these issues at a more in-depth level. But thank you so much for joining us for these sessions. And at least
I'll just like to say one last thing. Very often when we talk about resilience, we look at resilience as being an individual phenomenon. It is not an individual phenomenon, and that some of that comes out from our self-help books. Okay, the kinds of things that we find all over the places. Where you go into any bookshop, you'll find these self-help books. Okay, they just translate from English into Hindi, into Marathi, into whatever. Okay. But the fact is that, look, resilience is not just the individual. We need to look at what is there in terms of the society, what is there in terms of family, what's there in the workspace. Let's also remember that as adults, we spend a lot of time at work. And what are work environments doing to support people?
True.
Whether it is, providing the right kind of food.
Yeah.
You mentioned the eating disorders. I think a lot of eating disorders stem from the kind of food you get in the workplace.
No, and come to think of it, we spend half our waking hours at the workplace, or even if at home, half our waking hours are spent working. So there's clearly a larger overlap on our mental health emanating from work-related issues or behaviors or interaction than from the family alone.
Yes. And at the end of the day, how many of us are happy with the fact that we go to work every day? I think organizations need to think in terms of how do we make people want to come to work.
Absolutely. No, that's very well said, Sujata. And we'd love to, do a larger sort of series with you at some point in time. But thank you so much for bringing some of these issues to the fore at the summit. And
thank you so much. It's been a pleasure talking to you.
Likewise.